Hi, everyone, and welcome back. I'm jazzed to have you. I have my velvet sweatshirt on. I am ready to chat. My name is Janelle McSwiggan, and I am so happy to have you guys here. So, this is a super fun topic. It's a really dense topic this week. This is medical writing. I'm probably going to make multiple webinars on this, and this one's just going to touch the surface. It's going to be more of a, is this for me? What does it look like? What are the some of the very, very broad categories? And these aren't even all the categories. I'm going to go into some of them another time, but just so you kind of start to understand what they look like, and you can be like, oh, is this even close to what I want, or is this like in over my head? So let me share my screen and we will just dive right in. All right. So, medical writing, part one with Janelle McSwiggan. Willow Bark Health Writing is my health writing company. That's me, you guys. Um, we're just diving right in, I guess. I usually talk about who I work with. I do work with some larger companies. A lot of them are medical writing companies. I've been writing for about 4 to 5 years now. Pharmaceutical companies, medcom agencies, now reaching into regulatory. I've taken two university accredited certificate programs on medical writing, as well as some smaller like Udemy courses. I definitely recommend taking the bigger university courses versus the ones just done by creators. And this is coming from a creator. If you want to really learn about like the different types, that's what you should be doing. They will not teach you how to run a business. That's what my course is for, but they will tell you how to write, say, like a white paper. Um, and before I was a medical writer, I was a registered nurse at the bedside with pediatric special needs kids. All right, let's get right into it. So, what is medical writing? Medical writing is a highly regulated type of technical writing. Writers will focus on the clinical side of content creation. So this is different than health writing. This is different than copywriting. Copywriting sells, right? It's not really regulated that much, like a little bit, uh, but not as much. And it's way less technical. This stuff is dense, you guys. Like this is dense stuff. Um, so you'll work primarily with pharmaceutical companies, biotech companies, and researchers. You will sometimes work with publications, and there are some like umbrellas where you could talk to the general public. And I like to call this the nerdy side to writing in the best way. I mean, nerdy in like a good way, like it's a super intellectual academic side of it. So if you love research, if you just love, diving in and looking at deliverables or sorry, um, like statistics and just getting into the nitty gritty, like this is your jam. If you just kind of want to surface level read what like the American Heart Society is saying, like you probably are not going to like this. So I just want to make that clear. And I'm starting off with what does it look like? And guys, I know you're not supposed to put a wall of text on a PowerPoint, but I think it's also incredibly important that you understand the difference between like the lighter deliverables and what this is. So this is obviously not a video script. This is something very dense. I'm going to read some of it. I'm not going to read all of it. So in this retrospective study, first of all, that's very dense. Researchers analyzed electronic health records from the whatever. They included medical or surgical ICU patients, but excluded the cardiothoracic ICU. Pregnant women had the lowest mRNA VE from 14 to 20 days after the first dose. And then it says VE equals 59%, 95% confidence. Oh my gosh, I forget what that stands for. Oh, you guys, I'm so embarrassed. Um, so you get the point. You get that it's very dense. Researchers use ANOVA or Kruskal-Wallis to analyze the descriptive differences between groups. So this is what you would be writing. This is not what you would be reading. This is what you would be writing. You would also be reading this sometimes, but this isn't like type 1 diabetes affects 45 million people every year. know the signs and symptoms of type 1 diabetes. Like this is a totally different animal. So before we even dive into it, I just wanted to throw this up there so that you understand that it's totally different. Um, Lots of numbers, lots of statistics, lots of dense medical jargon, lots of like analysis that you wouldn't see in other deliverables. So yeah, just want to make that clear. Okay. So medical writing versus health writing. So they are super similar and they're technically under the same like umbrella term, but I like to differentiate between these two just so that you understand how particular medical writing is. So like health writing is more conversational. And medical writing is more like medical jargon, what you just saw. So when I started talking about that, like blog type of post for type 1 type diabetes, like that's something that you would, I call it the mom test. My mom is not a nurse. So if my mom can understand it, then it's health writing. If my mom has no idea what's happening and I have to explain it to her, then it's like medical writing. My mom would not know what was happening on that last slide. For health writing, the target audience is usually the general public. For medical writing, the target is usually clinicians or a regulatory body or, another giant pharmaceutical company. But most of the time, it's not like the regular, like run of the mill, like my mom or my dad. Health writing, you can have a surface level understanding of nursing research. Like you don't have to do like crazy deep dives where you understand everything about how a clinical trial is conducted. You can just be like, oh yeah, like this is what this is generally saying. Okay. Medical writing, you can't really fake it like that. You have to have a deep understanding of the clinical research as well as how clinical trials work, as well as like the particular wording. Like they just use very particular wording. You need to understand what that means. Inferiority, superiority, non-inferiority, all of that jam. Medical writing is more on health and wellness. So, how do I treat this rash? You like yoga breath, breathing, like that type of thing. Because it's more conversational and more geared towards the general public, and that's what they want to know. Medical writing is more focused on clinical principles because the target audience is like clinicals or clinicians, sorry, or like pharmaceutical giants. So that's the difference between that. Health writing is not technical. You could be writing like LinkedIn posts for a nurse. That's health writing. That could be health writing. Medical writing is incredibly technical and incredibly regulated. So that was that previous page there. It's usually done in AMA style. Health writing, not really important what the style is. It's more conversational. So those are the two key or not two key differences. Those are the key differences between these two main categories that actually fall under the same umbrella. So we went over how are they different, but they actually have a ton of similarities as well, because they do come from like the same type of vibe. So they both use clear, concise language, even if you don't understand what what medical writing is saying, like a clinician will, or you should, you know what I mean? They also have excellent research. You have to be accurate either way. Um, Health writing still needs great, accurate, current research. You might just not have to go as in depth as you would with medical writing. So nurses will still do amazing. So will all healthcare workers with both because they have clinical and educational backgrounds to back it up. So that could be one or the other. And both will work, like in either one, you'll work closely with an editorial team to follow specific style guides. So whether you're working on white papers, there's a very specific guide, or INDs, very specific guide, or blogs, very specific type of style. So you're still following that very specific vibe. Some deliverables still favor the active voice, so that's still similar. organizing content in a way that makes sense. So you're not just like randomly throwing stuff in there. A lot of the time you'll still like see subheaders and lists and bullets and graphs to break up walls of text. So a lot of those principles are still the same. And you're getting clients like the same exact way. And you're also launching your career the same exact way. So we go over like needing a portfolio, picking your niche, and getting clients. All of that is still the same. It still holds true regardless of what side you want to be on. And the how you run your freelance business is still the same regardless of if it's health or medical. So you're still dealing with the same like life cycle of a freelancer and how you're going about client acquisition, sending invoices, everything like that. So pretty much just the deliverable is different, and maybe who your editors are in publications. Those are different. But overall, they have some very strong overlapping themes that are still the same. So what makes a good medical writer? I think this is important because not everyone makes a good medical writer, and that's totally fine. Not everything needs to be everyone's cup of tea, and that's the beauty of nurse writing or health writing in general, because there's so many different nuances that you can hop into. So you need to have a strong background in biostatistics. You need to understand what you're saying and what those statistics mean. So what is standard deviation? What is mean, median, the whole shebang. What are those graphs telling you? Is this important? Is it not important? So strong background in biostatistics. You need to be able to break down that complex research into smaller components so your target audience like understands what's happening. Because they are clinicians, they are really smart pharmaceutical companies, but they're like, no one is an absolute genius, like Jimmy Neutron genius. You know what I mean? Like you're gonna still have to break it down in a way that they understand. Sure, it's not breaking it down as far as, explaining it to your mom or dad, but you still need to break it down and make it relatable. You need to understand the life cycle of a medication or device in the standard practice. So you need to just know like clinical operating procedures, clinical research, everything like that. You need to be a meticulous writer and researcher because this is a heavily regulated area. It comes with a lot of specifics. For example, you can't use animal trials, human trials only, set abbreviations that you can't use, very specific formats for different forms. Some scenarios require some forms. And not only can it delay you, it can cost your publication money and it can cost you guys to get denied. So you need to be really meticulous overall. You also need to work well within a team because you might be working with not only an editor, but maybe a medical affairs team, a regulatory team, and all that jazz. So it's not just you, like when you're writing a blog and it's just you. You have to get along with the people that you're working with. You also have a strong understanding of research trial design. If you don't, definitely go back and brush up on that. Everything is written in the AMA writing style. So there is a style guide for this. So I do recommend you either getting that or brushing up on it. It is very important. So how sentences are structured, punctuation, grammar, that type of thing. No research ethics. That kind of goes with research trial design, and be able to use inclusive, sensitive language, which is the same for health writing as well. So this is one type of medical writing, and this is called promotional writing. So this is a really popular one. It's kind of like copywriting, advertisement, kind of. So you create marketing and advertisement material for pharmaceutical companies, medical facilities, or corporations. So have you ever heard of like medcom agencies? Those are medical communication agencies, and they can specialize in that. So maybe it's slide decks, maybe it's posters, maybe it's figuring out presentations, maybe it's building a whole website. That's promotional writing. So if you're a copywriter, you might be interested in that. So grant writing. So grant writers secure funding for medical research through grants. So they'll search and secure grant funding and coordinate with the research team to make sure they meet the requirements. So you're kind of like the liaison between whoever is potentially funding you and the clinical coordinators. So it's a pretty competitive field of medical writing. You have to, one, be able to produce results because how good is a grant writer that can't get a grant? You know what I mean? So that's super important. Um, you also have regulatory affairs. So these are regulatory writers that work in a pharmaceutical or like a biotech company to create the documents for FDA or any other regulatory agency to approve medication, devices, and treatments. So the approval process is bananas. You have to do multiple stages of clinical trials. You have to design those trials, do operating procedures. You have to give the FDA the information, or, if you're in Europe, it's not the FDA. They have different governing bodies, but I'm going to say the FDA because that's what I know. So you have to have meetings with the FDA, maybe you might have to write them letters. There's all different like forms that you have to fill out. So it's like working on one very long deliverable, and it's kind of high stakes. So you have to be very good at knowing what type of deliverable to write based on where you are in the life cycle of the product that you're a part of on that team. So with medical writing, and I only used three examples right there. I might do a second medical writing webinar where we go over more, but that's it for now. But there are a lot more. So what can you write? So you can do advertisements for pharmaceutical companies, slide decks for a biotech company, grants for research proposals, scientific manuscripts, abstracts, news briefs, conference presentation, continuing educations, health news, public relations, and announcements, and so much more. There's a lot of jobs in this as well because pharmaceuticals is a really up and coming like type of employment opportunity. What general tips do I have for medical writing? Sorry, it's cut off right there. Okay. If you don't understand, take a course. These are not like blogs where you can kind of learn on the go. I would definitely take a course, and I would take a college accredited course. I wouldn't take one from someone random. Network and apply for jobs. Do both. Make sure you're covering all your bases. You tapping into that network of people. Because this is a highly competitive field, and it will most likely take a while to get into unless you have very specific backgrounds in like oncology or vaccine research, or maybe like clinical trial research, that type of thing. So you're going to have to like really, really make an effort to get in here. It is not going to be as easy as blog writing was. I will tell you, it took me about a year of trying a lot to get in, but I'm finally in. So don't give up, but just know that it's not going to be as easy. So get ready for rejection and being ignored. So read up on the different aspects of medical writing because there are so many different areas and they all have different characteristics. They all work on different things, and not all of them are super, super dry. Like what I just said. You can also do editing for this area too. Definitely brush up on your statistics because you can't really understand the depth of an article if you don't understand like the statistics that the article is presenting to you. And then you just kind of look like you're lost. You're just kind of like, oh yeah, I think this article says this, but I'm not really sure because I don't remember what my biostatistics course taught me. So definitely brush up on that. The American Medical Writers Association is amazing. They have a ton of great resources. You can become a member. I think they have a medical writing course as well. Don't pitch slap, that's the basic one. Don't say, hi, I'm Janelle. Do you have a job? Hi, I'm Janelle. Will you hire me? No one likes that, then they will just ignore you. Prepare your resume for medical writing. We have talked before about resumes. They are a hot topic. I will tell you, everyone will want your resume as a medical writer. Sure, for blogs, maybe they don't because whatever, it might be, couple hundred, several hundred. But for medical writing, we're talking about high paying competitive deliverables. So just get it out of your head. You cannot argue your way out of a resume. Get it ready because they will be asking for it. And if you don't have one, they don't care. They'll just scoot on past you because the next person will have one. So this is kind of a non-negotiable. I know it's a hot topic with a lot of writers, and those writers are probably working in blogs. They're probably not working in highly regulated deliverables like medical writing. Um, look up the examples of medical writing to make sure you can do the work before you sign on. Because there's nothing worse than signing on and you're like, oh man, I didn't know it was going to be like this. I didn't know it was going to be this dense, or, so make sure that you're doing the research to figure out if that's like the type that you want to do. So it kind of just comes back to reading on the different aspects of medical writing, because they are so different, which is very interesting as well. There's a couple of other, like I said, categories I didn't include. So how can I help? I have the freelance writing master course. I want to be clear, this is not a medical writing course. It touches on it, but it will not teach you medical writing. It will touch on it though. This course will show you how to get clients for medical writing, how to send your medical writers invoices, how to set up your LinkedIn so medical writers and editors can find you, that type of thing. I also offer coaching. I do 4-week or single sessions. We can talk about medical writing, what the different types are, that type of thing, and figure out which one could be good for you. We can work on other things. I've worked on writer's block, mental health things, whatever we decide, whatever you decide, actually. I also have the portfolio building package. I do offer one for some medical writers, depending on what the niche is. Like I said, it is so broad. I can't do it for every single one. But I do run a special that it's if you buy 2 portfolio building packages, you get the third one free. And that's a full portfolio that you can send to your potential clients. Because I am such a proponent of free education, I do run the free webinar series. There are many webinars in this series. I have a free weekly newsletter. I have a free weekly blog, and I also post free tips daily on LinkedIn. If you guys have a recommendation for a webinar or a topic that I should cover, I am more than happy to listen and yeah, make one for you guys. So how can I help? These are all the ways I can help. Write, researching, editing. I'm your girl. I have tips and tricks to make it faster, how I do it, how to save time, how to network the right way, scaling, LinkedIn strategy, optimization, writing cold emails, the different types of writing, pretty much anything. If you can dream it, we can figure it out. So if this was a live session, I would do frequently asked questions right here, and I would take questions from the crowd, but I get it, you're a busy person and so am I, so that's why we make the recordings. If you can ever join me in the future, I think it's a great thing to have the banter with the community. I love to take questions and I love to give back. So it's a great time to get to know me and to get those specific questions answered that you might not have gotten answered in the webinar. So thank you guys so much for having me. It was such a pleasure to teach you something that is so close to my heart. So I am super active on LinkedIn. My name is Janelle McSwiggan now. You guys can send me a message, send me a connection request. If you have any quick questions, feel free to shoot me a message on there. My email is willowbarkwriting@gmail.com. And you can also find all of my resources, including the free blog, at willowbarkwriting.com. Guys, thank you so much for learning about this super fun topic with me. I will see you next time. I'm probably going to do a series of medical writing. It is a crazy dense topic. So there will be more to come. Thank you guys so much. Enjoy the rest of your day. Bye.